Good afternoon, everyone. As we just wait for everyone to log on, we're just going to give it about a minute today just because this is a shorter session. But please go ahead and take the pre-session survey if you have not. That helps us track all the other education that we're putting out to you, and then you'll do a post-session survey at the end. That should be linked in the chat. Just going to give it 1 minute and then we'll get started. And if you haven't and you just signed on, please go ahead and just fill out that pre-session survey in the chat. All right, so let's get started as this is a quick session. Welcome to today's MicroLearn on RASH. MicroLearns are new to our team, and we'll be presenting them throughout the month of September, which is really exciting to us. We have 5 topics, and all of my colleagues will be presenting 1 or more topics this month. Just some housekeeping things. If you have any questions, please feel free to put those in the Q&A box. The Q&A will probably go over time. So if you do have questions, you can hang on at the end and we'll answer your questions live. If you don't have any questions after you complete the post-session survey, please feel free to log off the webinar, but we'll hang around for anyone who does have any questions. Again, those will go in the Q&A box. If you have any interactions or need anything from the team, or if you have any reactions to any of the participants, if you want to introduce yourself, please feel free to do so in the chat box. That's another function of this Zoom, and that'll either be at the top or the bottom of your screen. All right, so let's go ahead and get started. This is a MicroLearn RASH for 12 noon. It's about 15 minutes long. So today we are going to talk about what you should do if you see a patient with a rash. So a MicroLearn is designed to be a quick 15-minute presentation or conversation meant to reinforce infection control concepts. So today I'll present the topic and also show you how you can present the topic as well to your colleagues. So before presenting a MicroLearn, you want to make sure that you check with the policies and protocols at your facility and adapt the content accordingly. You want to incorporate MicroLearns into existing opportunities where groups of healthcare workers gather, such as pre-shift huddles or team meetings. If you do like a full team report in the morning or afternoon, whenever your shift is. The session should be led or facilitated by an experienced team member with infection control expertise. And the MicroLearns reinforce infection control concepts when risks are observed in patients or in the patient environment, not necessarily in visitors or other staff members. If a team member witnesses a patient in distress, such as shortness of breath or bleeding, they should respond to the emergency per the facility protocols. So you can facilitate running a MicroLearn, but make sure you're also including your facility-specific protocols into the MicroLearns that you may share with your colleagues for further knowledge or reinforcement. Today's agenda, we'll do a welcome and introductions. We'll go over learning objectives. We'll talk about what a rash is, what causes a rash, what healthcare workers do if they see a rash, or what you should do if you see a rash. We will do some like reflection and key takeaways, and then we will have a end of session feedback. If you want, you can stay on and we'll go over a quick Q&A. Learning objectives, we are going to hope to understand how to identify a rash and what causes rashes, know what steps to take if you see a rash, apply your knowledge to your facility policies, PPE, and job safety, and then hopefully you'll feel confident in delivering MicroLearn materials to colleagues. So the Project Firstline Infection Control MicroLearn are a series of guided infection control discussions. They provide brief on-the-job educational opportunities, and each MicroLearn focuses on a single infection control topic. Today, we'll discuss the topic of rash. However, throughout the month of September, again, my colleagues and I will present on numerous topics, including blood, diarrhea, a draining wound, and cough and congestion. And you can sign up for these at projectfirstlineri.com. I will have Abby put that in the chat just in case anyone has not signed up and wants to sign up for the rest of them. So let's just jump right in because it's quick. When we were first teaching part of a MicroLearn, you're teaching an infection control concept, you first want to just introduce the topic. So today we'll discuss rash. What is a rash? Very simply, a rash is abnormal skin that is usually red, irritated, or broken, and may have bumps, flat spots, or blisters. Keep it really simple, really basic, right? We're just reinforcing knowledge. It is important to remember when recognizing a rash, of course, that rashes appear differently on different skin tones. So in most textbooks, unfortunately from classical teaching, we see how rashes appear on white skin. However, we care for patients with many different skin types and tones. So on this slide, we have an example of Lyme disease. And you can see, or the Lyme disease, quote unquote, bullseye rash, and you can see it appears different on each person. So it's important to know that a rash might not look the same on everybody. And what causes a rash? Rash can be caused by many things, including germs that can be spread by touch. You may also not be able to tell what has caused the rash just by looking at it. Many viral infections can be associated with a rash and can spread to other people or to the environment. Some viruses, such as chickenpox or measles we've been hearing of lately, can travel long distances in the air and can easily infect people who are not immune to them. These viruses can spread when the infected person breathes or if the rash is disturbed, such as by scratching or rubbing the area, which can then send the infected fluid or debris into the air. And some rashes are not caused by an infection, but by a injury or allergic reaction like poison ivy or bug bite. So these rashes can still contain germs that can be spread by touch. So it's important to know if you potentially have a rash with a fever, then you'd want to think that's probably more viral than a rash that's not accompanied by a fever, which could be more of, like we said, an allergic reaction or a bug bite or something like that. So after you simply present the topic, you are going to want to expand on it, right? So we know what a rash is, we know what it looks like. Now we're going to want to expand that topic a little bit more. So how do we do that? What should healthcare workers do if they see a rash? And this is what you'll discuss with your team. So don't touch the patient's rash if you don't have to. If you do have to touch the rash, use gloves, regardless of the cause. Any rash is a vulnerable area where germs can enter the body. So you're not only just protecting yourselves, you're protecting the person who has that rash. If it's possible to cover the rash, it's often best to do so, but there are some exceptions. So make sure that the decision is made by the clinical care team. Germs can be spread from a rash to anything that touches it. So make sure you clean and disinfect surfaces and properly handle linens that have touched the rash. And as we kind of briefly mentioned, if the rash is accompanied by cough, congestion, fever, if there's a possibility that it's caused by a virus that spreads through the air, make sure you're separating the patient from others. Consult with the clinical and infection prevention teams and consider whether additional infection control actions are necessary, such as putting the patient in a separate room with the door closed or required transmission-based precautions. Here, it would be important to also know a patient's vaccination history to take some considerations into infectious rashes like measles or chickenpox. So again, we're not diagnosing, but we should be identifying a new rash and taking the appropriate steps to prevent transmission to visitors and staff, as well as protecting this patient from breaks in their skin then causing infection. The CDC does have a great library of useful posters and teaching aids, including this one here, discussing how germs are spread through the skin. And aids like this can support your knowledge and then also support the teaching of this topic to others and are printable if you have a place where you'd like to showcase job aids like this. Or maybe you do like a topic a month and this month's topic is skin or a week or something like that. And then step 3 in the MicroLearn, you would discuss with your team. So here, I just posed a bunch of questions. While teaching the topic to others, there are some questions you may want to ask to provoke critical and anticipatory thinking. So we can just go through some of these together. You can put your answers in the chat, but this is something you could ask your team if you're presenting a MicroLearn, or as we're kind of doing here, I'm presenting / teaching how to do a MicroLearn. So what do you usually see first, or what do you usually do when you see a rash first? You can go ahead and put answers in the chat, but I can also give you some of my answers if you'd like. So here's some key things that you'd want to do. Report to a physician. Would you isolate them? Yep, you want to make sure you isolate the patient if you feel as though it's like infectious and a high risk for spread or that it was already spread to you like in a more serious situation. Potentially isolate yourself, but more so isolate that patient. Make sure you're checking for fever and other symptoms. You have a good picture of what this patient is looking like. And you're able to confirm your vaccination status, things like that. Do you worry that you might catch something? How do you protect yourself and the patient that you're taking care of? Again, another thing that you can ask your team that you're presenting to. So maybe you might want to ask about PPE. What do you want to wear? Do you stay out of the room? Do you go into the room? Do you cover the rash? Do you leave it open? Gloves, and if applicable, a mask. Yep. So like what kind of PPE you're looking at. Then you want to make sure you're asking your team, when might you call or for help or assistance? Basically, it's important to know that if you see a rash, it should be reported to the care team, all the members of the care team, and it's properly documented so that anyone going into that room would know that there is something going on there. They're not walking in blindly and then realizing that they're exposed to this infectious rash. Do you have all the tools and information that you need to do your job safely? So this would be very facility specific. Do your staff feel supported in the workplace? Do you feel like you would know what to do if you had a new onset rash? And then as a team, how can we help each other take the right infection control actions when we see a rash to keep germs from spreading? And you can go over that with your team as well. So you would notify your care team promptly. You'd go over room signage, special precautions for immunocompromised, pregnant, or under-vax staff. All right. And lastly, you would just wrap up and reinforce all of the important takeaways. Again, these are supposed to just be like really quick in huddle reinforcement of a topic. So our key takeaways: some rashes are caused by germs that can spread to other people or the environment. Different causes of rashes can require different levels of transmission-based precautions. Whatever the cause, broken or irritated skin is a vulnerable area for a patient. Treat it carefully, and notify the patient care team of any new rashes for further assessment and next steps. Here are the references for today's session, and we are going to get into our end of session feedback. So please go ahead and fill out our end of session feedback poll. This will help us improve our future training needs. Again, for those of you who have any questions, how to do a MicroLearn or any specific questions on this MicroLearn, go ahead and stay on. I will stay and answer any questions. If you don't have any questions, once you're done with this feedback poll, feel free to log off. Have a great day, everyone, and I hope to see you in the rest of the September MicroLearn sessions. Take care.